Okay, so the journal that we had to read was The Effects of Traditional Chinese Exercise in Patients with Chronic Obstructive Pulmonary Disease. Just like an introduction to it, COPD involves airflow limitations. They're not fully reversible. So it's a pulmonary disease, and the article was talking about how traditional Chinese exercise, they refer to it as TCE, affects those patients. So the research question was, what are the effects of TCE on COPD patients? And then we're just supposed to talk about our views on it. So what struck you guys out in the article?
Go ahead. Sorry.
Well, just my initial thoughts after reading it. I feel like there'd be a lot of pushback from the patients, just because it seemed like, just like how people think now, they'd be like, why am I doing this? And although it might be like studies that might support it, there still might be a question of why am I doing this, or they might feel like it doesn't really help like the studies have shown.
Okay. You don't think many people would want to do that or want to try it or experiment with it?
I feel like maybe the older patients would probably be more okay with it, just because it'd be like more exercise for them and it'll help them feel like they're staying in shape. But as far as like people our age, I feel like they wouldn't go along with it, and they might just overall just stop showing up because they feel like it's unnecessary and stupid.
Okay. All right, Brock, what about you?
It's like the reactions of like the effects of TCE on COPD patients. It said at some point in the article that the results were mixed and inconclusive. So like there wasn't like a set, I don't know what word I'm looking for, is like a set result that showed that the traditional Chinese exercises were actually working for COPD patients. It was just kind of like a mix between some, it was for some, wasn't for the others. So like, I feel like either the, they didn't test enough people for it, or like another thought I had, like with how many people they tested, like the certain criteria for testing was like, they had to have, let me find it. It was like they had to have COPD for a certain amount of time, and like there couldn't be like any acute symptoms of COPD.
Okay.
And so like I feel like that limited enough, but like even with the mixed conclusions, I don't feel like if they were to expand the criteria for it, it would change the results. So I thought, I didn't think that the exercises were effective for COPD. So
you didn't think so, even with the because like in the results and stuff that they do say that it's, so when they go through outcomes and says the quality of life, they say TCE was associated with statistically significant improvement in quality of life. And they said that, I think they said that for all of them actually, except for emotion. Said emotion was not improved with COPD patients. You're saying just like on a larger scale, like it worked for some of the trials, but not all of them? Is that what you're saying? Okay.
Kind of going off of what Brock said, talking about increasing the sample size or the criteria, I feel like that if they would like open it up to less chronic conditions of that what is it, COPD,
Yeah.
it might actually show like a significant sway towards a definite answer.
Yeah.
Okay. So what was the study's research question, or their hypothesis, or their objective, actually?
Their objective was to see like how traditional Chinese exercises would impact people with COPD, and just going with that, they wanted to see, I think the specific like time was like 6 minutes of the exercises or something like that.
Yeah,
To,
there's
Is that for just the walking
yeah.
exercise or something?
Hmm.
Was it 6 weeks that they did the tests for?
Yeah, they did. It was more than 6 weeks. So all the studies
Longer than 6 weeks, yeah.
longer than 6 weeks. And one of them, yeah, the 6-minute walking distance improved in 2 of the trials in 3 months, and then one of them it took 6 months to see any improvement in it. So like there's improvement with all these categories over time, but they're not. It doesn't really come quickly and stuff. And I think it's smaller things. So like, yeah. So for the fatigue and stuff, and they talk about why that is. They talk about like the reasons for it. The reason for like positive effects may be that TCE exercises requires close coordination of breathing and movement with the diaphragm. So it's a lot with like almost like meditative stuff. It works a lot with like just like controlled and conscious breathing and stuff, which increases like balance and lung capacity.
So like with that, would that just be because they were doing exercises so that was increasing no matter what? Like with a person without COPD, like that would do the same thing for them?
They say that so they compared each group. There's 2 groups. There's one control group, and they have just the normal standard rehab stuff. So just like normal PT, and then like drugs and regular doctor visits and stuff. And then they have the other group, which is the TCE group, the TCE intervention group. And they say that their exercise, like stamina, basically, like how much exercise they're able to do, increased in the TCE group because they worked on that breathing and they worked on the lower extremity developing and stuff, because TCE like has a lot to do with lower extremities and like knee and ankle proprioception and stuff like that.
I don't know if it addressed this like in the actual paper, but I think a better way to like for them to like track progression is to have like a baseline to start from, like have like a survey from the participants to see what their initial exercise level was.
Okay.
That way they could like for somebody who improved very little but was already very active, they could take that into account when they do the results. And I feel like that would have gave them like more conclusive information.
Okay, yeah, that's true. That's good. So that's like one of the weaknesses of it.
Yeah.
Did any of you read like on like the methods again, like of how they gathered the data and stuff?
Didn't they just like search up like through databases and like it had, so like I wrote it down. Like with the databases that they used, like it was up until August of 2015 or something. They found 232 articles. 48 of those were duplicates, so they removed those. 169 of those were unrelated, and then they had like 15 remaining articles that were actually like useful for their study.
Mm-hmm.
And then like, find it again. There was like, give me a sec here. So like of the 15 that they use, 10 of them met the inclusion criteria, and 8 of those of the 10 were included in the meta-analysis part of the study. So
yeah,
and I think it's right here. And the data extraction part of the methods, it said that the studies are screened by different, what they called raters, and they just went from there. I guess they had 2 people or maybe 2 groups of people rate the studies to see if they best fit or didn't.
Yeah, that's right. That's good.
And I think that is kind of I think that's one strength, because it brings in like an outside source that's not particularly biased towards one or the other. They're just given the information and asked to evaluate it.
Yeah, good, exactly. Corey, you mentioned like what you thought one of the weaknesses were, or one of the strengths or weaknesses was. Brock, did you notice any when you were reading through it?
I wasn't really looking for strengths and weaknesses. If you would come back to me, I could find one.
Okay. How do you guys think the results relate to the current practice, and how might they influence the future practice?
I think because they found indeterminate, like non-conclusive results, and whether it was a increase or decrease in their overall like breathing function and lung capacity, that they would need to try varying different variables such as acute versus chronic, or maybe try to find different age groups so that they can like find commonalities within like certain groups, whether it's based on age, maybe it's even geological or something like that.
Okay.
Something better organized than all of them just having one thing in common, that's just the chronic condition of the disease or condition.
All right, good. Okay, well, I thought it was pretty cool. I thought that the traditional exercises actually, I think they'd be pretty beneficial because, I mean, like COPD affects like a really kind of like an older generation normally.
Yeah.
So, and lots of times like rehab, like strenuous rehab isn't really doable for them. So, this kind of rehab, it provides like a mild aerobic, it's like a really mild aerobic rehab, and it's a lot about like breathing, so it's like diaphragm strengthening, stuff like that. It's all about like core and stuff, and it doesn't require any equipment and stuff. And I think it's pretty beneficial. Like just with like I think it would be beneficial for COPD patients. Do you guys have any other thoughts on it?
My personal thoughts, like I've always been like interested in like Chinese medicine because I thought it was always interesting, and I've always